Hello, my name is Tabitha. I'm the orthopedic navigating nurse over here at Bone and Joint. And I am with you today because you are obviously getting ready for a total joint replacement surgery. This is something that we don't take lightly. We know that this is an outpatient procedure, but there is still a lot of preparatory work and planning that you need to do before the day of your surgery. And that is the purpose of this session. I know many people wonder why they have to have maybe a class or this video to watch. And that is because things have changed a lot over the last few years in regards to our total joint replacement surgeries. It used to be that when you planned on having a surgery like this, you would set up camp in the hospital 2, 3, 4, 5 days. And that has changed a lot. We have basically streamlined the procedure, perfected it. The anesthesia that goes along with that surgery has also been more perfected. So patients are not needing to stay asleep for quite as long. They are coming out of recovery quicker. They're feeling better. And so more and more patients were going home sooner. So our goal now is that we get you home as soon as you are medically ready, and for the majority of our patients, that means the same day as your surgery. Now, it would be unfair for us to not set you up for success and let you know everything we want you to know before the day of your surgery. So we're going to go through a lot of information together today, and hopefully that will help delineate maybe some big questions, concerns, and overall anxiety that you may have before this procedure. So this session is for you. I will try to cover a good amount of information, and hopefully it will clear your mind. The first thing I want to let you know about is Force Therapeutics. This is something that we do specifically for our joint replacement patients. This is an app that you will be invited to through your email or your cell phone. It'll come on behalf of your surgeon. And so I want you to know about this up front so that, number one, you know that it is legitimate. This is a way for us to track your progress throughout your surgical process, your recovery process, and another way for you to communicate with us. Once you have your surgery, you won't be normally coming back to see your surgeon for about 4 weeks. So knowing that you have Force Therapeutics is just another safety guard that we have as far as being able to watch your progress, knowing that you're going to be able to track your pain, your activity, and communicate with us when needed. This will save phone calls. You can get on there and text us, and it will be like a live chat that goes straight to your surgeon's office clinic and to myself as backup. So keep that in mind. Watch for that invite to come across your cell phone or your email. But if you don't have a cell phone that can accommodate that, or you don't have an email, that is totally fine. And this is not something that you have to have. It's just something that we do offer. So I do want you to know about that right from the beginning. One of the other things that I like to discuss with patients in regards to preparing for surgery is different ways that we always want to protect that total joint and protect it from infection. You're going to hear me mention preventing infection a couple times during this session. And that is because we always want to ensure that infection is nowhere near your new total joint. So when it comes to preparing for surgery, we're actually going to put you to work. We're going to provide you with what's called CHG wipes. We call them CHG wipes because that's easier to say than chlorhexidine gluconate cloths. But come surgery morning, if they ask you if you have used your CHG, I want you to know what that is. If you haven't already, you will be receiving 2 bundles of CHG wipes. You'll get 2 sets of 3, and each package only has 2 wipes in it. You need to hang on to these until it's the night before your surgery. In preparation, what I want you to do that night is to have clean sheets on your bed. Plan on taking your shower that night, and then also make sure you have clean pajamas ready to go. Once you take your shower, just like normal, take a regular shower, normal soap. When the shower is over, we ask that you do not utilize any lotions or powders on your skin. When this is all done, you're going to wait about an hour, and then you're going to grab your first bundle of wipes. You'll also want to have your joint education book with you, where you'll find your instructions, and you're going to follow the instructions that are printed on that page, and there's a little square that will walk you through package 1, package 2, and package 3. We want you to pay close attention to the details in that square because that is going to guide you through the process of what wipe goes where. There's only so much medicated soap on each wipe, so if you overuse it, they will not be effective. The medicated soap and the aloe that is in that wipe will make your skin feel wet and sticky. What you need to remember is once it's on your skin, you do not rinse it off, you do not dry it off. You have to let it dry, and as it does, it forms a barrier on your skin to help prevent extra dirt and germs from staying there. That is why it's important that you're getting clean pajamas on, climbing in that clean bed for the night after you've done this work. This is one of the first ways you're helping us help prevent infection. Now, the next morning is surgery morning. So you do have to repeat the process, but we do not want you taking a second shower. We don't want you washing off that first barrier. We want you adding to it. So you will simply set aside some time to go through your last bundle of 3 packages, and you will follow the instructions just as you did the night before. Let all of that dry, and then put on clean, comfortable clothes and head on into the facility. Now be mindful, there are some instructions at the bottom of the page that says the second set of wipes has to be used within 6 hours of surgery time. This does not mean that if you have an 8 o'clock surgery, you're getting up at 2 a.m. to do the wipes. This just means you have a window of time to complete this task. So as long as you're doing it before you come in to see us on surgery day, you're well within your window of time. Now we're talking about keeping your skin clean. I also need you to take good care of your skin. What I mean by this is I don't want you showing up surgery day with fresh cuts, scratches, maybe cat scratches or dog bites, anything that possibly could open you up for infection. This is something that we take very seriously because we want to protect you. And so what we ask you to do is to be very mindful, especially if you do have pets at home that like to maybe play, scratch, jump, bite, keep your distance. We will also ask that if you have any area of concern, maybe an open area, a sore wound, something that hasn't been healing right or already looks infected, please discuss this with your surgeon so that we are aware of that and we can maybe help ensure that it heals properly before you have your total joint surgery. The other things that we're going to ask you to keep in mind is leading up to surgery day, we're also going to guide you to stop shaving about 3 days prior to surgery. This is to prevent any possible open areas you may create if you are shaving and you accidentally cut yourself. So just keep those in mind and discuss any concerns with your doctor. So I always guide patients on the most important things we want you to think about and to do leading up to surgery day to set yourself up for success. One of those other big steps that we really discuss and offer support in is quitting smoking. The reason that we talk about this with our orthopedic patients is because, again, it's another way to help prevent infection. What we worry about is overall poor wound healing for our patients who smoke. There's an increased risk of pneumonia after surgery, and the nicotine negatively affects those bone forming cells. So we really want to give you an opportunity to quit before surgery day. The sooner you quit, the better. But we also understand that quitting is not an easy task. We do work hand in hand with the free resource of 1-800-QUIT-NOW. They provide us their information to pass along to our orthopedic patients. So if you want to reach out to them, you're more than welcome to call them. If you want more information, you can always come to us. We have little packages of information we can give you there at Bone & Joint. So keep that in mind. You can't smoke while you're in the hospital, so it's a really good jump start anyway. And we just want to offer our support for you when it comes to quitting smoking. Now, as you are preparing for surgery day, one of the things that you will be required to do is to come in and see either Dr. Cocovello or his nurse practitioner, Elizabeth Kent. because they are the ones that will be clearing you before you have your surgery. This appointment will be set up with the surgery scheduler or with Dr. Minighini's nurse. When you come in, what you need to keep in mind is they are the ones that are going to be reviewing your medical history and all of your medications, so it's very important that you have the most up-to-date information for them. If you see them and then maybe a few days later you have to go see your heart doctor and they change your blood pressure medicine or maybe a other type of medication, you need to ensure that you go back to them and let them know there has been a change. They are the ones that are going to give you guidance as far as what to take leading up to surgery day and also on the day of surgery, and that information will be printed out for you. So please make sure that you follow their guidance and ask them any questions during that appointment and to keep them up to date on any possible changes along the way. One of the things that they most likely will discuss with you is the fact that on the day before your surgery, when you wake up that morning, they're going to ask that you start taking about 1,000 milligrams of acetaminophen every 8 hours throughout that day until you go to sleep. The reason for this is because there has been some research behind this showing that if you have that buildup of acetaminophen in your system, it does help a little bit more with post-operative pain control. So this is something that you can expect for them to talk to you about when you see them. Now obviously if you are already on a medication such as Norco or Percocet where acetaminophen is part of that medicine, then they may not guide you to do this. But that will definitely depend on your dose, and that will be discussed with you in person. Some of the other things that you can expect to learn from them is the timeline on when you stop eating and drinking before surgery, and that timeline is 8 hours. We're going to ask that you stop eating solid food. However, they do allow that you have clear liquid diet up until 2 hours before your arrival time. Now I want to explain that. If I have surgery at 10, most likely my arrival time will be at 8 a.m., which means I stop my clear liquid diet at 6 a.m. So I always want to make sure you understand that timeline. Now clear liquids obviously can be included such as like water, plain tea, plain coffee. We don't want any sugar, no creamer, no protein drinks. If you have a juice of any kind, there cannot be any pulp, but those types of things are allowed, and so that is something that will be discussed with you at your preoperative appointment as well. It's just a little different than what you might be used to, so I always like to give you a heads up. Now some of the things that we also like to explain, because some patients worry about, is what to bring on the day of surgery, what do I wear, and I always encourage you to keep it simple. Think about what you're having surgery on. If you're having your hip done, then we're going to ask maybe just wear all elastic waist pants. Something very loose fitting through the bottom, through the hip area. That way it's easy access. If you have those back on and they need to see that dressing, they can simply slide that down. No buttons, belts, snaps to worry about. For our knee patients, same kind of concept. Think of what would be easy to maneuver in. If you wear long pants, make sure that that pant leg is loose enough. It can come all the way up mid-thigh so we can see the entirety of that knee. So the thought process is this: yes, you're going to be in a hospital gown for part of that day, but once surgery is over, part of your teaching, your evaluation, your assessments with physical therapy and occupational therapy will be kind of relearning how to dress yourself. Now that you have this new joint, we want to make sure you can be independent, dress yourself, but do so properly, safely, and in the less painful way to do that. So that will be something that you will do after surgery is over. I also always want to remind you, you want to always make sure you have your ID, your insurance information. You don't need to bring all of your medications on the day of surgery. Simply just have an updated medication list. These are just always reminders we want to tell you about. If you bring your cell phone, bring your charger. We do not have enough chargers to go around. And one thing to be mindful of is the fact that you are not allowed to wear jewelry anywhere on your body during the procedure. So I just guide patients to take all of that off, leave it at home where you know where it's at and where it will be safe. Now obviously things like glasses, hearing aids, dentures, partials, you need those every day, bring those with you, have them with you. But if you have a case, bring those cases as well. That way when they're not being utilized, they are safe. And one of the other things I want to let you know is we ask that you wear good walking shoes on the day of surgery, because our goal for you, as long as it's safe to do so, once surgery's over, we're going to get you up and we're going to get you walking. So we don't want you showing up in flip-flops or house slippers or Crocs or sandals. We want good shoes that won't add to you being a fall risk. Once those hip joints and knee joints are in you, they can hold your body weight. You will not hurt yourself by getting up and walking. The best way to hurt yourself is by falling. So we are going to be very diligent in ensuring that you don't fall and that you are very comfortable and safe to go home. So just keep all of that in mind as you're preparing for your surgery day. And also don't forget to bring a friend. We need someone with you on surgery day, not only to get you there, but to also get you home. Even though you may be going home the same day, you will not be driving. You won't drive for a number of weeks. This is something that will be discussed by your surgeon, and they will clear you officially when it is safe for you to drive. There's no definitive timeline on when that happens. It's based on a number of things. Number one, my left leg versus my right leg. If my right leg had surgery done, then most likely it'll be a little bit longer for me to drive than someone who had their left leg worked on. Also, if you are still on the prescription pain medications, you're not going to be able to drive. And if you're still using a walker, most likely you're not ready to drive yet either. So just know there will be some discussion between you and your doctor on when it is safe to drive. And when they do clear you, if your right leg was the surgical leg, I highly recommend that you go to a parking lot where you can see what that feels like to press on that gas pedal, press on that brake. It's one thing to think, yep, I'm good to go. But if someone slams on their brakes in front of you and you have to make that strong, same motion, you need to make sure that you're confident in doing that. So that is a little recommendation that we guide everyone to think about and to do before they hit the road. Now, you will receive a phone call before surgery day comes regarding when to show up to arrive at your facility where you're going to be having your procedure done, and also when your surgery is planned for. So just know that that phone call generally happens the day before surgery. They will confirm that with you. We ask that if you do have a walker, if you don't actually need that walker to walk with, you don't have to bring it into the facility. You can leave it in the car, and that way when you are sitting outside your home and you're ready to go in the house, it's right where you need it. Because anyone that works with you after surgery, they are going to provide a walker for you to use. Therefore, if you bring your walker in, it will just be sitting there for no reason. However, if you are borrowing a walker from someone, or if you've received a walker from maybe VFW, Goodwill, and you don't know if it has been set appropriately for you, then please bring it in, and physical therapy or nursing will be more than happy to set that walker height to make sure that it will be a good working tool for you. So keep that in mind as well. Now, once you do arrive to the facility, if you are having your surgery at Union Hospital, that is building 1, you're going to go right in the main front doors and go to the big circle desk right there at the front. That's where you're going to check in. They will make sure they get you registered, and then they're going to guide you down to the ambulatory part of the hospital. If your surgery is at Wabash Valley Surgery Center, obviously there's only one door to go in, and so that's where you will go in. They will get you in their checked into their system and take you back to your area in the ambulatory part of the building. You will be allowed to have a friend, your family member with you up until just about the time it's time for your procedure. You will meet your nurse. She will start your IV. You will be having some fluids that will be running on you before your procedure, so keep that in mind as well. You will be able to meet and talk to your anesthesiologist before your procedure. This is a good time to ask them any questions. I always encourage you to share any concerns that you may have, or if you've had anesthesia in the past and you had trouble with it, please make sure that you voice what those issues were, because they're getting ready to take care of you. So the more they know up front, the better off you are of maybe having this recovery be much more comfortable. One of the things that they most likely will discuss with you is the type of anesthesia that you can expect for your procedure. We use what's called a multimodal approach when it comes to anesthesia, which means there's variations of what they may choose to do. This decision will be between your surgeon and your anesthesiologist, so that'll be part of the discussion. One of the things that they most likely will discuss with you is the possibility of a nerve block. Now, a nerve block, the decision for you to have that will be up to your surgeon, but your anesthesiologist will discuss it with you and you will have to sign a consent for it. So you will know if that is part of your plan. Now, I don't go into a lot of detail regarding the type of medicine and the location of where the nerve block is placed, because that's what they're going to do with you in person. But what I want you to understand is the reason behind the nerve block. We do the nerve blocks because this is what's going to help with post-operative pain control. The nerve block itself, once it's placed, you will know it because it's going to make your leg feel numb, heavy, full of sand, and that just means it's working. These feelings can continue. The nerve block can take effect from anywhere between 12 to 24 hours. So what I need you to keep in mind, a lot of times the nerve block gives a false sense of what you're going to be dealing with post-operatively as far as pain goes. So you get through your surgery, you come out of recovery, you're starting to work with therapy, and you are feeling pretty good. Everything, the surgery's over, you're up moving and grooving with that walker, and you're feeling pretty great. You're hitting all those green lights to go home. And you get home and you're still feeling pretty good, and then maybe your friend or your loved one says, hey, you know what, it's time for your pain pill. And you think, you know what, this isn't that bad. I don't think I need that pain pill. And we all are here to tell you, take your pain pill anyway. I don't want you to not take that pain medicine and then have an issue for when the nerve block finally does wear off. Like I said, it's a range of time of how long it's in your body. It depends on how quickly your body metabolizes that medication. And there is no warning when the nerve block wears off. It just goes away. And I don't want you to have any fear thinking that something is wrong. If you have not kept up on your pain medication, then you're going to be starting from behind the starting point as far as keeping your pain under control. And it's really hard to catch up. So you will be going through a lot of information at discharge regarding your type of medication that the doctor has prescribed for you and the regimen in which you need to take it. And we're going to ask that you stick with that routine when you go home, because it will be very, very beneficial for you for when the nerve block wears off. So the other reason I talk about pain overall is not to cause any fear, but just because we want you to have a realistic expectation going into this type of surgery. Even though it is an outpatient procedure, it is still a very significant surgery. And so after surgery, it is not realistic for you to think that you will not have any pain. Our goal for you is that the pain is tolerable. We know you're going to have some pain. We know that you're going to have swelling. We also know that you're going to have bruising, and that bruising can look uglier before it gets any better. But all of this together is normal. And so I just don't want you to have any concern when you possibly are experiencing this after your total joint replacement surgery. One thing that I always stress is to please, please, please communicate with those caring for you on the day of surgery. When you're coming out of recovery, please make sure that you let those nurses and therapists know if you don't feel like your pain is under control. And then if you go home and the pain medicine makes you sick or you can't tolerate it, please share that with us, because we can try different things to help you. We just don't want you going home and suffering and feeling like that there's no other alternatives. So communicate, communicate, communicate with us, all right? We want to do our best to help you through this. One of the other things that you need to understand about pain medicine is the direct correlation between pain medication and constipation. It's never a topic that people want to talk about, but we do expect that this could be a problem for you. So you need to know that you will be going home on what's called a bowel protocol. These are specific medicines that we will start you on the day of surgery, and you will have instructions on when to take those every consecutive day later, based on whether or not you poop that day. So keep that in mind. Obviously, as you start to slow down on the pain medicines, you will also be able to slow down off of the bowel protocol. So I just want you to know that that will be part of your discussion at discharge as well. One of the things that a lot of patients are worried about is timeline of surgery, how long they are going to be under. And so what I tell you is generally a good timeline is to plan on about an hour and a half, maybe 2 hours when it comes to these types of surgeries. It depends on your surgeon. It also depends on a little bit of the patient's anatomy once they get in there. But a good general number is about an hour and a half to 2 hours. Someone from the surgical team will come out to your family member or friend, whoever is waiting on you. Let them know when your procedure has started, so they know they have about 2 hours to wait, and you all get a 2-hour nap, because that is your job, to sleep through it. You are going to feel like they just put you to sleep, and 4 seconds later they're waking you up. But it will all be over. You will be in recovery. You'll be closely monitored by a nurse. They will have you hooked up to the blood pressure machine, pulse ox, watching your heart rate, and all of that to make sure that you're recovering appropriately. If you do wake up and you have some oxygen in your nose, don't panic. It doesn't mean you're going to be on oxygen forever. It just means you're taking a really good nap. So generally, most patients are in recovery anywhere between 45 minutes to an hour. When you are fully awake and doing good, they will let your visitor come back and be with you. So just a little bit of knowledge as far as some average timelines for you to plan for, okay? The other things I want you to be aware of, when you wake up, you might be wondering, what the heck is squeezing my feet or on my leg? And that is what we call an SCD machine. That stands for sequential compression devices. These are something we use specifically while you are not up moving, because we don't want blood clots. These types of surgeries increase patients' risk of blood clots, and so we're going to do a number of things to ensure that we help prevent that from happening. So the first thing is, number one, we're going to get you up and we're going to walk you as soon as you're ready to do so. If it's safe, we're going to walk you. Secondly, we're going to have those SCD machines on you. What those will do is they will inflate with air, they squeeze around your feet or your lower leg, and then they let go. And as they squeeze and release and squeeze and release, they are helping increase the blood circulation to your lower legs as if you were up walking. Now, a lot of patients like this, and they want to take that home with them. They say it feels like a good foot massage, but unfortunately we can't give that to you because when you go home, we want you doing the work of circulating that blood to your legs. But I just want you to be aware of what to expect and why those will be on you while you're under our care. The other thing I want you to expect on the day of surgery is the incentive spirometer. Now, this is a tool that they will review with you on how to use it, how often to use it. They'll do all that teaching with you in person. What I want you to know is why we want you to use it. Many patients, if they've been in the hospital, they may already have one of these, but we're going to give you another one. And that is for a twofold reason. Number one, this type of surgery, you run an increased risk of possibly running some low-grade fevers as you are recovering. So for the first week after surgery, if you notice your temperature going up and down and up and down, it does not mean you are sick. It does not mean you are infected. It just means you've had a major surgery and your body's fighting to heal. So running a low-grade fever off and on is normal. Using the incentive spirometer is a way to naturally bring down those fevers. The other reason that we want you to take that incentive spirometer home and use it is because you also run an increased risk of developing post-surgical pneumonia. You've had anesthesia, you've had some pretty good pain meds, you're going home not feeling too good, you're not doing a whole lot of work, and neither are your lungs. And that is why your risk of developing the post-surgical pneumonia goes up after surgery. Now you might think, well, I've had my pneumonia vaccine, so I should be fine. But what we need you to understand is that to fight post-surgical pneumonia, you have to actually exercise your lungs. And this tool is going to be what will help you accomplish exercising your lungs. They're going to tell you to use it about 10 times an hour. And that might sound like a lot, and it might be hard to watch the clock, but I always tell everyone, as you're at home, you're recovering, you're watching TV, anytime those commercials come on, use your incentive spirometer and you're going to hit your goal. But it serves a very, very important purpose, and so please expect that, and please remember to use that once you're back home. Now, often patients are also wondering about the type of dressing that they may have over their incision. So we do want to let you know one of the most common types of dressing is called an Aquacel. This is a sample of an Aquacel dressing. It's kind of like a heavy-duty Band-Aid. This will be placed on you during your procedure, so it'll be placed in a sterile environment. Once it's there, it's totally occlusive. So that means all those edges are well sealed against your skin. And that's the way we want it to stay. They are also waterproof, so you will be allowed to take a shower as long as it's been at least 24 hours since surgery. You'll be fine to get in the shower, let that warm soapy water go down that dressing, and then you just pat it to dry. We don't expect that you will have to do anything with that dressing. As a matter of fact, your job is to look at it and basically leave it alone. As long as it is staying well adhered to your skin and you're not having any issues with it, that's what we expect. Now, sometimes you may notice that the middle of the dressing starts to develop some dark spots. That's totally fine. That is due to drainage. And drainage isn't anything that we worry about unless there is so much of it that it actually starts to come down outside of the dressing. So if that happens, you are welcome to wrap gauze around the outside of the dressing to reinforce it, but again, do not remove that dressing and then put gauze on it. Still leave it alone, reinforce it, and then you need to call us, because we'll probably most likely need to bring you in and make sure everything's looking good as far as that incision, and possibly do a dressing change. When it comes to the timeline of this being on your skin, these dressings are made to last. They're made to stay on you for a week or two. You will get guidance on your discharge instructions on when to remove that, because most likely you will be the one to take it off. When that time comes and your incision is exposed, please remember that we don't need you to do anything to the incision. You don't need to try to clean it with peroxide. You do not need to place any ointments like Neosporin on it. Your job is still simply to look at it and leave it alone. You are welcome to take a shower once that incision is uncovered. Still go ahead, take that shower, let that warm soapy water run down the incision, and then again, just pat it to dry. If you do start experiencing drainage after the dressing is gone and it persists, please let us know that as well. There is a second type of dressing that we want you to be aware of. It's called a Prevena dressing. Now this is less common, but still we want you to be aware of it again, so that if you wake up and this type of dressing is on you, you are not worried. It doesn't mean that something bad has happened. This specific type of dressing, the decision to use this will be based upon your surgeon's choice, and it's usually used if we are worried about excessive drainage, maybe healing issues, someone that might have diabetes, or maybe a higher BMI. Those are all aspects that may help the surgeon decide to use this specific type of dressing. So if you have this on you when you wake up, you will get very specific instructions regarding the care of that dressing itself, the little wound vac that will be attached to it. You will even get the personal information of our correspondents from the company, who says that anyone that has any questions or concerns are welcome to call him. So just know that you will be well supported and well educated about that specific dressing, should that one be needed for you after your procedure. One of the other things, like I mentioned earlier, that we have a lot of education about is trying to help control your swelling and therefore also helping to control your pain. Because we can't help the fact that you will experience some swelling after this type of surgery, but your goal is to help keep it under control. So the ways to do that is by elevation and using ice. So first of all, if you are a knee replacement patient, you need to know that a lot of times our knee patients experience swelling sooner, and they have a higher risk of that swelling spreading and going further down the leg. And so you have to be really diligent with ensuring that you elevate appropriately. The second thing you also need to remember is proper pillow placement for that elevation. You know, your surgeon has gone in and given you a great new knee that bends really well, but what they've also made certain of is that that knee is straight. That back of your leg is straight when you extend. And so when you go to elevate, we want to always make sure gravity is working with us and not against us. So we want those pillows to be placed lower on the leg, about mid-calf down to your heel area. If the support for elevation is down low, that's going to help ensure that gravity helps drop the back of our leg so that nothing is under that knee, and the back of your knee drops nice and straight. This is going to be a little rough in the beginning, but the more you do it, the better you'll get at it. What we worry about, a lot of patients start creeping that pillow up from under the calf. They bring it up further and further until they put it right under that knee. And what happens then is your knee is bent. And if your knee is always bent when you're elevating or relaxing, then it will also heal that way. You will develop scar tissue, your muscles and tendons will heal that way, and then when you get up to try to walk, you won't be able to extend that leg straight. You'll actually walk with your knee bent. And many times when this happens, you will have to go back to surgery for what's called a manipulation of the knee. So we just always want you to remember that when you are elevating, if you're a knee patient, when you are elevating, we don't want anything under that knee. So please keep that in mind and make sure that you have enough pillows to help keep your toes above your nose, because that's going to help that swelling come down out of the knee, go up towards your heart, and our hearts are what help get rid of that swelling. So we always want gravity to work with us, so think about positioning properly when you elevate. The other way that you're going to help control swelling is by utilizing ice. Now you will be provided an ice pack after surgery. This is something that you'll be able to take home with you, and you'll be able to keep refilling that and using that off and on. Textbook timelines for using the ice is 20 minutes on, 40 minutes off. The more you use the ice, the better off you'll be. But you always want to remember that you don't put ice directly on your skin. You don't need frostbite on top of everything else. But I encourage you to move the ice around on your leg. If you're having your hip done, it's not just going to hurt on your hip. It's going to hurt down lower on your leg, maybe across your bottom, the back side, your lower back. So always remember, just move that ice around to wherever it's sore. Knee patients, it's not just going to hurt in your knee. You're going to hurt above the knee, below the knee, behind the knee. So every 20 minutes, rotate that ice around and do the best to help control that pain and that swelling with the ice. Now, hip patients, you heard me mention earlier about how the proper way for a knee patient to elevate. There's also some things you need to be aware of when you go to elevate. It doesn't matter so much about pillow placement for you, but what you do have to keep in mind is the fact that you're going to have to follow what's called hip precautions. Hip precautions are certain motions that you are not going to be able to make. Once surgery happens, you won't be able to make these motions anywhere between 4 weeks up to 3 months after surgery. Your doctor will let you know when they clear you from the hip precautions, but what those entail are, number one, you are not to bend past 90 degrees. So if you drop something, you can't bend all the way down to pick it up. We also don't want you crossing your legs or your ankles, and we don't want you doing big twists or turn at the waist. All of these movements are made to help protect that new hip joint. Once it's in there and in place, as everything starts to heal and get stronger around that area, we want to protect that area, and repeatedly making these motions over and over can possibly impede that healing and ultimately could possibly pop your hip out. So a lot of times we tell people about hip precautions and then they're afraid to do anything at all. But we always want you to remember, we still want you independent. We want you to be able to take care of yourself with the help of that walker, get up and move around. And so we want you to get your hip kit. Now, a hip kit are multiple devices that therapy will go through with you after surgery. And I have these devices here to show you. The first one is obviously, this is to help you in the shower. This is so you can still wash your lower legs and feet without bending past that 90 degrees. Long-handled shoe horn, again, so you can get your own shoes on without bending forward too far. This is everybody's favorite, the reacher, grabber. You can pinch people with it. This is very handy, just so if you drop something or to help get your shoes on, this will be very beneficial for you to have after surgery. And then this device always confuses everyone, but this is actually what we call a sock aid. This will help you get your socks on and do it on your own. And like I mentioned, occupational therapy will ensure that you know how to use all these items. What you need to remember is getting these items before surgery day, or at least maybe having the plan for a family member to get these items for you before you head back home. We have all of the hip kit items for sale in the lobby pharmacy inside Union, or at the UAP Clinic Pharmacy inside Building 8, the medical office building on the first floor. You can get all of those items for $19, and the reason I tell you to get them from there is because this is the cheapest you will find it. I've priced it against other pharmacies, against Amazon, and you're going to pay double. So please, please, please get your hip kit. That way you can remain independent and still abide by those precautions as you heal. Now, when you go to elevate, what you need to remember is when you are sitting in a chair, your hip is already at that 90-degree angle, right? It's like an L. And so when you go to elevate, you can't just prop your leg up, because then that hip joint goes from an L to like a V because you've lifted that leg up. So we always ask that you lay down first. You can take the angle of that hip and make it nice and wide, lay down first, and then you lift your leg up, and you will not worry about breaking that 90-degree bend. So when you go home, lay down on the couch, on the bed, get your leg up, however many pillows it takes to be comfortable, and elevate your leg that way, and you won't have to worry about going past that 90-degree precaution. So that's what you need to keep in mind as you go through your healing and your elevating those first 2 weeks after surgery. That's when we focus on that. So the other things that I always like for patients to understand is knowing that you will be placed on a blood thinner after surgery. A lot of times, if you are already on a blood thinner, the doctor will put you right back on what you were on. Sometimes they may need to change the dose. Whatever the reason is, they will take that in consideration as far as why you were on a blood thinner. But I want you to understand that if you've never been on a blood thinner, you will be on one for anywhere between 4 to 6 weeks after surgery. So it would be a good amount. Please take it for the full duration of what your doctor has prescribed for you. This is another way we help prevent those blood clots. We want to ensure that we have you on the appropriate type of medication to ensure that you don't develop those as you heal. So that will be discussed with you and a family member upon discharge. It'll be all written out so you understand what you will be on and how often to take it. I just want you to know to expect that. And to also remember that when you are home and you're icing, you're elevating, you're taking your blood thinners, it's very, very important also for you to do the work of walking. We want you to walk every 1 to 2 hours, get up and move around. Number one, it's going to make you feel better. You're going to feel a little stiff if you just lay there with your leg in there all the time. You're going to need a break. So please go walk around your house. If you go from like your bedroom to the kitchen to the bedroom, that's a walk. Living room, bathroom, living room, that's a walk. It doesn't have to be down around the block and back. We just want to make sure you're being cognizant of keeping up and moving and circulating your blood. That's also going to help prevent pneumonia because you're going to expand your lungs. It's also going to help aid in digestion and prevent constipation. So it's very, very important that you continue to do that when you're back home. Now, obviously, when it comes to therapy, therapy begins the day of your surgery. They will come into your room wherever you're at. They're going to start working with you as far as passing all the things they need to know you need to be able to do before you go home. They're going to make sure you know how to walk with that walker, do all those transfers from a bed to a chair to the toilet, back off the toilet, in and out of a car. So there's going to be a lot of work that you do with them before you even head home. And they'll also ensure that you know how to do some stairs. So if you have someone with you on surgery day, they'll be sure to include them as part of the therapy goes and the teaching so that they know how to assist you once you're back home. When it comes to planned therapy, our knee patients, you will be set up for about 6 weeks worth of physical therapy. This can be done through an outpatient facility of your choice, or we can have home health care where someone comes to your home if maybe transportation is an issue. Or some patients may be well enough to where they can just use the Force Therapeutics app as far as activity guidance there. But whatever the plan is, this will be discussed, and you don't have to do anything. We will ensure that everything is set up appropriately and that your first session will be planned out and it'll be printed on your discharge instructions so you know what to expect there as well. Now, hip patients, just so you are aware, you will not need formal therapy when your surgery is over. The hip joint is much different than the knee. Basically, when you go from sitting to standing and you're walking, that is your therapy. Going from sitting to standing is all the range of motion a hip joint needs, and the walking as you heal is going to help improve on your muscle strength and engagement, and that'll essentially be all that you need to do. So I just don't want you to feel like we missed something when you don't have formal therapy, because you actually won't need it. So keep that in mind as well. Now, some things we do want you to consider as you kind of think about where you're going to be spending a lot of your time once you are back home, and the fact that you now will be walking through your home with a walker. We always guide you to clear your area of clutter. Pick up throw rugs, pick up extension cords. If you have narrow hallways with maybe little lamps or side tables, move those out of the way because we don't want you falling. I also ask that you consider about what your daily tasks are. If there are specific items you use every day and they're down low under a kitchen sink or maybe in your kitchen cupboards, get them out, put them up on your out on the counter so that they are right there where you need them and you don't have to bend. Also think about the tasks that you need to do every day. If you are the dog walker, the cat litter scooper, the vacuumist, the cook, you are no longer that. For the first 2 weeks after surgery, we want to make sure that you can focus on healing and being safe and not having anything that might possibly cause you to strain or hurt yourself or hinder that healing process. So pets are a big deal. Sometimes people forget to think about that pet care until they're already back home and the dog once let out and walked 15 times a day. So make sure you have other people ready to help you and have your area set and ready. The more you do up front, the better off you will be when you're back home. So when are you ready to go home? The things that we're going to be watching for, number one, like I've mentioned, all those levels of therapy, they're going to be going through your assessments, your teaching, making sure that you're safe walking with that walker, and you have to be able to pass all of their assessments. That's number one. The second one is your pain under control? We have to make sure your pain is well controlled. The other thing that we always are mindful of is, can you void on your own? Now, a lot of times after surgery, patients may have difficulty with urination, and so we can't send you home till we know that that is working well all by yourself. And the last one has to do with nausea. We do not want you sick. We want you to be able to eat and drink and take your medications appropriately. So we have to make sure that you're not feeling nauseous and sick. So once you're able to hit all of those items, we'll be letting you go home. Just always, like I mentioned earlier, we know we don't want you going home alone. So make sure you have someone to be with you those first couple days and nights after surgery. Those are the most pivotal times that we don't want you alone, because that's when you're going to be feeling kind of crummy, and we're sending you home on a new pain medicine. We're sending you home on a walker, and it's just not safe to be alone. So please make sure you have someone with you. Okay? Once it is time for your discharge, we want to ensure that you have someone with you. So when that nurse comes in to go through your instructions, you have a second set of ears and someone who hasn't been under the influence of drugs that day to hear all the information we're going to go over. You'll have a lot of important information on your discharge instructions. So when you go home, I advise you just stick it up on the refrigerator. That way everybody knows where it's at. You'll have a lot of references as far as phone numbers on who to call for what reasons, and depending on what day of the week it is. Your discharge medications will be ready to go. If you're having surgery at the hospital, you'll pick your meds up at the lobby pharmacy. If you're having surgery at Wabash Valley Surgery Center, you'll be getting it from UAP Clinic Pharmacy. So you'll want to get those on the day of discharge before you leave as well. All of your follow-up appointments, those will be made, and that will also be something you want to look at on your paperwork. Okay? So when do you call the doctor? When do we want to hear from you? So remember those little fevers I mentioned earlier. If you have a fever that doesn't go away or keeps getting higher and higher, please call us and let us know about that. If you have continual incisional drainage that just keeps happening over and over, please let us know about that. If you have swelling, redness, warmth in the calf, and a lot of pain that is not relieved after you ice and elevate and take your medicines, then we also need to be aware of that. Should you have any shortness of breath or chest pain, please don't call us. That's a medical emergency and you will need to call 911. But just keep us posted on anything that you have concerns with, okay? Some things that you always will need to remember once you have a total joint replacement surgery is you might be the life of the party when it comes to getting through some metal detectors. So you always want to plan for that. Communicate if you're at the airport or have to go into a courthouse. You always just want to communicate with the security guards there that you have had this procedure. We do not give those cards out anymore that you used to be able to present. You'll just simply talk to them about it and they'll be able to see that new joint as you are scanned through their system. So keep that in mind. The other thing that we would like to always remind you of is when you have to go see your dentist. You'll always want to remind your dentist that you are going to need an antibiotic. This is a protocol that dentists are very familiar with, but your job is to talk it through with them. Like I mentioned earlier, we always want to protect that joint from infection. Our mouths are a great place to harbor bacteria. And when you go in just for a simple cleaning, there still is a risk that that bacteria gets in your bloodstream. And so taking an antibiotic on the day of your cleaning or your procedure, that will help be proactive in preventing infection. So make a plan with your dentist. If they want you to have your surgeon call in that antibiotic, that is totally fine. We'll do that for you. Just let us know what you need. And remember, this is for the rest of your life. Some dentists may say, hey, it's been 7-8 years. We don't need to do this anymore. Your surgeon says this is forever. So if they won't prescribe it, just talk to us and we'll make sure it gets done. The other thing we want to guide you on is once you have a total joint surgery, we're going to ask that you don't have any dental procedures or outside procedures or like something like a colonoscopy for about 3 months after your total joint surgery. And again, this is to protect it from infection. So if you already know you have something going on, maybe with dental issues that have to be addressed, we want that all done before you have this surgery, okay? So just some other things to think about as you are planning for this. So in summary, you always need to remember to elevate. We want gravity to work with us, not against us. Keep that swelling down. You keep your swelling under control. It's going to help keep pain under control. We want you to use ice off and on all through the day to help control the pain and swelling. We want you to take your blood thinner no matter what they prescribe for you. Just take it for the full amount of time that they've ordered it. And lastly, always remember to get up and walk every 1 to 2 hours, and this will help prevent blood clots, prevent stiffness, and keep you on the path to a good recovery. So that's all I have for you. I know I gave you a lot to think about, but hopefully this helps in your preparation for your upcoming surgery. Thank you.